New Brunswick is the only province in Atlantic Canada without a gender-affirming care clinic, and the province's transgender healthcare network is advocating to establish one in Fredericton. Doctors with the network say it would cost about $2 million, a fraction of a percentage of the province's estimated $4 billion healthcare budget.
The goal is to create a centralized clinic where all of these services that patients require are available within a single team, where people work collaboratively in order to reduce barriers for patients. It will give, referring providers a single point of entry. So everybody knows where they have to refer their patient to in order to get them the care that they are entitled to, and that they require.
The 2021 census shows that more than 2,100 trans or non-binary people lived in the province at that time. For people seeking gender-affirming care, a centralized clinic would help with navigating the healthcare system.
You have to be the one to make those pathways, when you often have to go, if you're lucky enough to have a family physician, and say, I would like to explore gender-affirming care. Not all family physicians are even aware of those pathways, or even if they know of some pathways, they don't know the whole system. So often patients we have to become the experts in navigating the health system.
Ray Organ began seeking gender-affirming care in Fredericton in 2021, but they faced a year-long wait for a mastectomy, never got referred for the hysterectomy they wanted, and had to wait another year to begin taking testosterone. And they say all that took a toll on their mental health.
Yeah, it was sort of a perfect recipe for me to not be doing very well. I certainly did have lots of mental health crises where I felt absolutely despondent. The gender dysphoria was certainly present a lot.
Dr. Taylor says long wait times are common. Her own wait list, just for an initial consultation, are about 4 months. She says that's half the time it takes to see some physicians because there are fewer than a dozen in the province who provide gender-affirming care. Taylor believes the upfront costs of a clinic would be worth it.
So rather than waiting for these patients to show up in the ER in crisis because they have not had access to gender-affirming care, and which, that costs way more money than having a appointment with a physician would, right? So spending $2 million now saves the system a lot of money in other places. The risk of suicide can be quite high, and that can have a huge cost to the system. So if we can treat those things and prevent those situations, those crises from happening, then that is only a benefit to our system and our bottom line as well, the budget.
The province's Department of Health could not confirm whether the funding for a clinic would be in the budget, telling CBC News in a statement that, quote, enhancements to gender-affirming care have been under consideration as part of the budget process, which is ongoing. But for Oregon, a clinic would be more than just a place to receive medical care.
I think we're headed in the right spot, and I think it's really important that we continue to, because we know that the world outside of New Brunswick right now, there's a lot of threats to people like me, and one of the ways that we get over those threats is we come together, we stand up, we speak out, and we do the right thing, which is to advocate for keeping us safe and getting us what we need.